Hello, my name is Melissa Knight, and I have lived in East Tennessee all of my life. As a matter of fact, I have lived probably within a 3-mile radius in South Knox County all of my life, and I wanted to tell you my story. As an adult, I have spent the last 17 years of my life working at the Interfaith Health Clinic, and we take care of the low-income, working, uninsured individuals who get up and go to work every day but have nowhere to go get their health care because they don't have insurance. So my entire adult life, in the last 17 years anyway, has been concerned with providing access. We've provided access in our community to our underserved population through many partnerships. We have volunteers who come on site, physicians, dentists, nurses, dental assistants, therapists, pharmacists, many different individuals who come on site to help us provide that health care to those individuals. But in addition to that, we've developed a network of partners of over 400 subspecialists who will see our patients in their offices where they have the specialty equipment that they need to take care of our patients. In addition, the area hospitals, the Knox County Health Department, the list goes on of how the entire community has formed a partnership to help take care and provide health care to the underserved. We could not do what we do at 315 Gill Avenue if we did not have many partners. But it goes beyond that. My story involves also, in the last year, I have had the good fortune to serving on a committee that we're really looking at how to make our entire community healthier. During the last year, we've looked at access, which I know a little bit about from working at Interfaith. We've talked about partnerships, which is a big part of what I do. But then the third part was policy. And to be perfectly honest, I kind of rolled my eyes and thought, well, that's great for somebody else, but I'm the kind that gets in the trenches and gets her hands dirty, so I'll leave the policy to somebody else. However, during our conversations, it occurred to me that I really did have a story about policies as well as partnerships. During that time, I recall that several years ago, our Knox County Commission decided to put a sidewalk from our area high school, South Doyle, to our elementary school, Bonnie Kate. Several of us kind of thought, well, if it was not being named after a gentleman that had been so good to our community, we really wouldn't have thought much about it because it kind of seemed like a waste of money. We're a rural community. Why do we need a sidewalk? Everybody has a yard. Everybody has a place to go outside and play and exercise or do whatever they want to do. But they put the sidewalk in. I cannot tell you how that has impacted our community. Number one, it is used. It's used early in the morning. This morning as I drove to work, I saw my dad and several other people out walking on the sidewalk at 7 a.m. But besides being used a lot, it's used to walk. It's used by joggers. It's used by people to walk their dogs. You see parents teaching their children how to ride a bicycle on that sidewalk. But even much more than that, it has become a community meeting place. We are all so busy and we go our different directions that we really don't take the time to stop and check in on our neighbors like we used to. This sidewalk has brought that all back together. People notice when you're not there. People say, I wonder where so-and-so is. I wonder if they're sick. I wonder if something is going on. So I'm very thankful in my professional life that we have people who are willing to participate in partnerships. But I'm also very thankful in my personal life that we have people who make policy decisions that impact a community far more than what I could have ever imagined. And that's my story about partnerships and policy.